It's question time from this afternoon, stroke this morning as well. The first question is at the back there.
This might seem like a stupid question, maybe. I know the advice around the junior infant vaccines for the MMR and the 4-in-1 is not to advise that the child should take Calpol or Nurofen because it can interfere with the efficacy of the vaccine. But it's very common in secondary schools with the HPV and the Menses that the child comes back complaining of a headache. Would you recommend paracetamol or Nurofen in that situation to be taken after the vaccine, either straight away or at home?
I wasn't clear why you said that they shouldn't be given in junior infants.
Well, somebody told me at some talk, maybe it's at this conference, that it can interfere with the efficacy of the vaccine if you give Calpol or Nurofen to the children after the junior infant vaccines, the MMR and the 4-in-1.
I've never heard that personally before, and I know that was an issue with the Men-B vaccine when they were doing it in babies. There were some old studies that showed it might interfere, but the newer study showed that it wasn't. So I would say in junior infants and in secondary school, if you need to give paracetamol, that should be fine.
Anybody else got a question? We're just trying to get the questions from the external people. Yeah, here.
Is there any consideration for the chickenpox vaccine? And can you give Nurofen? There's stuff on Facebook about that all the time, not to give Nurofen for anyone with chickenpox.
It's a pity.
Yeah, so Karina would be, is the chair of NIAC, and NIAC would be the people that would make that recommendation first of all, and then if the HSE decided that that was what they wanted to do, then we would be implementing that. So we haven't had advice to implement that at the moment. In terms of chickenpox and Nurofen, that's more of a clinical thing. That wouldn't be our particular thing in terms of a disease.
Here, there's a question here. Just wait. It's coming.
Sorry, about the BCG, you know, when we go out on the ground, a lot of the parents are asking about the BCG and will it ever come back in, and is there, you know, a rise of TB? They seem to be quite concerned.
Kevin will take that.
First of all, the TB rate in Ireland has declined, even in the period since we stopped BCG. It's probably going to end up this year around what it was last year. It certainly is at the moment. Our rate is what would be defined as low in international terms, and our rate, particularly for indigenous population, is it's around 6, anyway, 6.5 per 100,000. It is for the indigenous population around 4, 5, so it's low. The question of whether or not we reintroduce BCG is at the moment being debated by both the National TB Committee and NIAC about it, okay? It is also pertinent for most people that they should look back to the HICWA HTA on BCG, and a phrase, a couple of sentences in that not many people read, is it does actually say if you were to consider introducing BCG into Ireland on a greenfield site, you would not do it. We've now had a greenfield site for 3 years, so it's an interesting issue there. It is not cost effective in Ireland if you had never been doing it at the level of TB we're at, and our level has decreased since that HICWA investigation. There are far more effective interventions for TB control now than actually BCG when you're at our level of TB. So that's a debate that's going on at the moment. Any other questions? Yvonne, have you...
I just have some questions from people around the country. The first one, how often do healthcare workers need a booster dose of pertussis vaccine? Will we answer that?
Yeah, we'd have to look in the guidelines, I'm not sure.
Okay.
We don't think that they probably do, but...
We will have to answer that on the side.
That's no problem.
Go on, another couple.
You've covered a lot. There's a question about, is there guidelines for children getting chemotherapy? What vaccines they require?
Yeah, post-chemotherapy. Yep, Tom would know the exact number of the chapter, but there's definitely a whole chapter on immunosuppression and chemotherapy. So there'd be schedules that would depend on their age and exactly what they've had. It's chapter 3, apparently.
Any of us in the room? Here?
I have 2 quick questions. One, how late, I had a lady in recently who's just early pregnancy in the end of April. I'm wondering whether we should give her the flu vaccine or not for this season. When would you stop giving it? Because it's in date until the end of June.
Flu season is clinically over.
It is, yes, but we've declared the flu season over, I think, in terms of...
So,
Flu season's over, isn't it?
Yeah.
well,
Pretty much.
It was just kind of
technically,
borderline.
the flu season is from the beginning of October to the end of May every year, okay? Technically, okay? It depends on the actual flu, as you know, changes over that period. So that's when we're doing it. I would have suspect that if it's still now, that you should do it, but after the end of the May. If you don't have the vaccine, you can't do it as a but she should clearly get it as soon as it arrives in next October, September, October.
A quick question. We regularly do MMR and varicella screening on women people who are planning pregnancies. And I recently had somebody who was MMR negative, or mumps negative, but positive for the other 2. I'm just wondering whether I should offer her an MMR or not. Because there is some theoretical thing about first trimester and miscarriages.
For mumps, I think, and again, Tom gets a lot of queries about this, I think the mumps assay isn't as good as the other assays, so if she's negative for the other 2, if she's positive for the other 2, I should think she's probably protected against mumps.
Okay, thank you.
There's a question at the back and then one more here. Yeah, the lady.
Just to clarify about
Oh, no, sorry, it's the lady back there first, behind you. No, you can keep the microphone, it's just somebody behind you.
Hello. Yeah, I just have a question. Just wondering, could the NII do anything for the school vaccinations in relation to interpretation of the GDPR legislation? Some schools will give us class lists and other schools now won't, and it's the same legislation. So I'm just wondering, is there any help we could get? Because it's very difficult to run the programme without the class lists.
It's a perennial battle for us. We are involved in quite a lot of discussions about that. I'm not sure it's a very easy answer because, bluntly speaking, people use data protection and GDPR as a way of defending not getting involved. Our understanding is that there are no real barriers, but we've not been able to get to that point fully. We've been involved in negotiations with the Department of Education, the Department of Health, the Data Protection Commissioner and things of that nature. It is really quite difficult because people will use it to say no for other reasons. It's a very good way, but our understanding is there are no real barriers ultimately to its use. Because if you read the legislation, we're meant to be trying to protect the public health in these circumstances. But we will continue on that battle. Here, this lady.
Yes, would you be able to clarify about the MMR postnatal? I have a lady who was rubella negative, and after her first pregnancy, she got the MMR. Her second pregnancy now, she has delivered, and her rubella was negative at the start of that. Should she or should she not have another vaccination?
No. Well, she's got a documented at least 1 dose of MMR. Yeah, that's what the guideline says.
The assay is not that great.
Yeah.
It's a problem with the assay more than any other thing. Down here.
Sorry, Lucy.
No, sorry. Yeah. But we've got 2 microphones.
Sorry.
So yes, there's somebody here. Okay. But we've got somebody at the back again. There are 2 microphones, and I can see everybody's arms in the audience, okay?
Oh, that's me. Yeah. Sorry, Lucy, you were talking about the 12 and 13-month vaccines can be given together, but we've been advised that the Men B can only be given, Men B only in one limb, and I'm just wondering what way would you give the vaccines?
Yeah, Men B only in one limb. I think that's probably the same as the advice we would have given in the UK to start with, that you would choose just one limb to give it in, just so that you know about the local reactions.
No, but
and
you can't
could
give
say
3 in the other limb.
no. So it's fine to give it 2.5 centimetres apart. There's no reason. And that's not in the SPC that it needs to be in a single limb.
Okay, thank
it was
you.
probably at the time when it first came in so that you knew about local reactions.
Oh, that's great. Thank you very much.
Here we are.
Hello, sorry. I just wanted to ask about vaccine stock management. I agree with you, it's really important to do it properly and not to waste the stock. And you did mention training. I'm just wondering who would give the training. I think it's really important because admin staff often change and there's nobody really in charge or nobody knows how to do it properly. I know we have the guidelines, but I think to actually have a training session would be very important.
Well, it really is. The guidelines are on the website, and it is to go through that procedure with the new staff member. That's as much as you can do, and just to train them up to understand what they have to do. It's not very complicated, and the guidelines are there just to do an SOP on it for with other issues or other things that your staff member is doing. But have it part of it and just say, here are the guidelines and this is how you look after the deliveries, this is how you order, and it's all clearly done in those guidelines. The guidelines on fridge management and stock, they're the guidelines I'm referring to, and they're on the website.
But it is actually clearly the management of whatever the institution you're talking about's responsibility to ensure the staff that they have know what they're meant to be doing. So it's their responsibility, whoever is the manager of the overall process, I'm not sure if it's a GP practice or a clinic or whatever, but it's their responsibility to ensure the staff concerned know what they're doing. So it's their responsibility to ensure he or she has been trained to do what they're meant to be doing. So that's very clear in management. So it's either the GP or the practice manager or it's the clinic manager or whatever's responsibility to ensure that is so.
Sorry,
there's a question there.
Kathy just said
Can we just
e-learning.
quiet, please? You have to speak up.
Sorry, it's just Kathy mentioned it is on the e-learning as well, so they are available at every site. Thank you.
Okay, there's a question on my left.
Actually, I have a question for yourself, Kalina. I work actually in a third level institution and we have started doing STI clinics, and I know that the Gardasil vaccine is recommended for men who have sex with men. Is that covered actually on the cold chain? Is that vaccine available free on the cold chain, from the cold chain, if it is for that clinical need?
I will answer that. We are in negotiation with the Sexual Health Services side of the HSE about the provision of the HPV vaccine for those areas, okay? It's quite complex because clearly we've got to get it to all such places and we're doing that, okay? Secondly, we have to do it from our stock of HPV vaccine, okay, which we are carefully managing because we've got this changeover. So as we move on, probably more and more, but clearly there's equally a cost to us. So we've got to cover that, okay? But yes, we would try to do that, but it has not been planned for and paid for. So therefore, we've got to do it in a way that makes sure we don't overspend as a consequence. So we are actually providing at the moment HPV vaccine to places where men who have sex with men can be vaccinated, okay? But our difficulty is it's done out of our stock at the moment and we've only got a certain amount. So it is not necessarily going to be sufficient to do everybody or be widely distributed. We've got to work with the STD services to see what they estimate the amounts are and how we can do that as a consequence.
Yeah, and it depends if your site is already on that list. We have a list of STI clinics who are allowed to have it.
Yeah. But check with the sexual health because some universities are. So you can just check through, right? But that's the method. Once I get your site listed from them, then I can supply. Okay?
Yeah, there's a lady next to you and then there's one at the back, Peter. Oh, there, and then at the back, Peter.
Now, on a separate note, for immunosuppressed people that are on drugs like methotrexate or that, in the guidelines for hepatitis B vaccination, it doesn't include them, and also it includes people with certain medical conditions, but it doesn't outline what the medical conditions are. So we're just wondering where do we do about that, please?
I think that's something we're going to have to refer back to NIAC,
Yeah.
okay, for greater...
Yeah, there is a list of conditions, but we'd have to look at the guidelines. But
List of conditions, but then there's also people with certain medical conditions. That's included in the list of conditions, but my GP asked me to find out what was included in these certain medical conditions.
We'll have to look at that and then we'll try and come back
Thank
about it,
you.
okay? But it may equally need us to speak to NIAC if it's as imprecise as you say.
yes, it shouldn't be as imprecise as that.
No. Okay. There's a lady here, then somebody at the back. Okay.
I just have two questions. The first question is just about the rotavirus vaccination. If a baby presents late for vaccinations, like we were told that it was not to give it over the 8 months. So if a baby presents at 7 months and 1 day, we don't give the rotavirus vaccine at all. Okay. And the second question I have is about chickenpox vaccine. We had a mother present for the chickenpox vaccine 2 months after having a baby, and I'm just wondering, what would your advice be as to how soon to give the chickenpox vaccine after delivery? She's breastfeeding obviously at the moment, so we didn't give it, but we weren't sure what your advice would be in terms of a risk to the baby as well.
Yeah, our advice is we're not going to give any advice on that because it's not part of the national HSC programme in terms of the chickenpox vaccine. The NIAC guidelines do cover some of those other vaccines, like the varicella vaccine, because it's not one we supply. We don't give advice about that.
You're going to have to look at the NIAC guidance, I'm afraid, and if necessary, you'd have to then seek a consultant in either paediatric or adult infectious disease to advise. The lady at the very back here.
The NIO the last few years has produced school immunisation guidelines for the school programmes, and they've been excellent and really, really helpful. I just want to make sure that this year, that with the new vaccine and with the boys and with the catch-ups and all the rest, that the nurses can continue to prescribe on a medication protocol, that the guidelines are very, very clear, because there's a lot of changes. And I'm just wondering when we expect the new guidelines to be issued.
Yeah, we'll have them issued before the season starts. In terms of the changes, the men ACWI and C are very similar, and it's sort of a straight swap for that. And the HPV is for boys rather than girls. It's all very similar. I mean, HPV4 and HPV9 is very similar, but we are going to update the guidelines. The guidelines, I think, are hopefully going to have the medicines protocols at the back. What we're also doing in terms of the NIO, we're doing an e-learning and HSE land e-learning on HPV boys as well. That would be for the school teams. There'll be some extra information for the school teams, but that's also for everybody in terms of GPs, practice nurses, whoever wants to have a look at that to get more information and be up to date about the HPV boys as well. And we can do some slides on ACWI to put on our website.
Virtually the only changes are the names, in reality. Here and then here.
Hi, just a quick question about the HPV vaccine. I know a few people that are actually homeschooled. The children are. Is that covered under the immunisation? How would I do that if they came in to me?
Yep, so we get from TUSLA we send the packs to TUSLA, and TUSLA send them out to the homeschool people because we're not allowed to know who they are, and then they would be invited in for clinics, or they can call into the clinics. No, they go to the school clinics, not into a school, but then the school teams would always have catch-up clinics, so they'd be invited in there. So they're not excluded.
I'm just seeking clarification on the first years this year, first-year girls getting the HPV vaccine. There have been some girls who have been ill and could not start the vaccine. Can we still start them in September?
The ones that aren't
medical reasons.
The ones that aren't first years anymore.
Yes, first years now.
Yes, I think if they've had a good medical reason not to.
Then we can commence.
Fine,
and
yeah.
will they commence on 9?
If it's a new school term, yes, because you won't have anything else.
We will have some 4 left over at the beginning.
Yeah.
People that start on 4 should really complete on 4.
Complete on 4, and then any new ones on 9.
Yeah.
Yeah. Okay, that's fine.
Okay. I'm going to. Is there one last question?
Sorry, I may have misunderstood, but were you saying there that some men who have sex with men can have the vaccine, the HPV?
What we're saying is it's part of the guidance. We have been providing the vaccine to sexual health clinics, so they are providing it as part of their service, okay? It will, as we've done that fairly low-key to begin with because our availability of vaccine, But if and when we plan to do it, goes more of that nature, it will be advertised far more actively as a consequence.
Is that a public policy issue? Or?
It is a public policy issue, yes, and it's an issue for the, we're trying to do that at the moment because we had vaccine and otherwise we go to waste. But the actual doing it actively requires a fairly major statement by the state that it's going to happen and funding it as a consequence. Because there's quite significant numbers. The numbers would equate to at least 1 or 2 years of us vaccinating school years. So it's big numbers from our perspective. So we do need to get that. We are trying to do it, but it has not been funded. So we're doing it at the edges of our.
It's just I don't really understand then how, say, I would have to pay €1,000 for my 2 teenage boys to have it, and then you've got people who have life choices and they are getting it free.
Because our healthcare system is a public-private mix. And certain parts of our healthcare system are free, certain parts are not free. And those are decisions made by the government. And as you've heard, they've made certain decisions about HPV vaccine, okay? And that's what we're doing. In our legislation, it actually says access to STD services and treatments are free.
I have to say I don't agree with that because these people could
I
very
can't
possibly afford to have. No, I'm not saying it against. I'm not saying anything to you, but I just think it's a bit unfair that maybe these people can afford it when there's so many other people who might need it more badly.
We have made the decision to introduce it universally from this September. That will move through the system. That's the statement we have. The issue about men having sex with men is never a policy decision that's there with the government at the moment.
Yeah,
There's one last question, the lady there, and then we'll finish.
If I could just finish.
No, sorry, you've taken a fair bit of time, please. I'll speak to you afterwards if needs be, but this lady here.
Say, for example, somebody's in 5th year and they refuse the HPV in 1st year and they phone up now and say they want to avail of it. And we have said to parents up to now that they can avail of it because, there was a catch-up programme. Reading from the letter, it was saying, well, no, you can't offer it to these people. What do we do?
Well, we did speak about this a bit earlier. We are seriously contemplating, as the letter says, moving back to our policy, which was our policy from the beginning, that this is a programme only offered in 1st year, okay, of secondary schools. And that is what we would. There's lots of reasons why that is so. The vaccine works far better the younger you give it. Our 1st year is why we're doing this.
Sorry, just to interrupt you because I know everyone wants to go home, but I can understand all of that. But if it is going to be changed, it needs to be put in a letter that goes out to the parents that they are only allowed to opt in 1st year and after that, because until that happens, we can't withdraw it because we've been saying to them for the past 4 or 5 years that they can have it later on.
We will need to discuss that and probably issue such a letter.
Thank you very much. Thank you.
Okay. We're going to come to an end now, okay? Can I just say thank you to all the speakers, and particularly to all the NIO staff who have put this event together, both here and around the country. It's been quite an amazing task that they've done, and there aren't that many of them. There's barely 10, 12 people in the office, okay? So it's been a very major effort by them. Say thank you to our colleagues at the back who've been doing the sound and vision. And then finally from myself, a very big thank you to you all. You are the people who are making immunisation happen in this country. It is the greatest thing we do in public health terms, in healthcare terms, in this country. As the Minister said, this saves more lives than virtually anything else we do in this country. It is a significant impact on our health as a country. And you're the people that do it. You're the champions. So thank you very much indeed. Thank you.